and growth.
A robust primary health care driven by a team of community health promoters is what the government is banking on for a healthy nation as it seeks to achieve universal health coverage. These promoters play a critical role in identifying early disease cases and referring them to hospitals. In this next story, Baldino Liaula digs deep into the role of the CHPs.
Villages. According to President William Ruto's government, this will help push for preventive rather than curative healthcare. Community health promoters, or CHPs, are expected to provide a level 1 care of treatment.
I promise a fully publicly financed primary health care system, an emergency care fund, and a health insurance fund that will cover all Kenyans.
To get into the workings, deliverables, and expected outcomes of the new community health promoters, we turn to Dr. Maureen Kimani, who heads the Community Health Division at the Ministry of Health, the body that is responsible for overseeing the CHPs and health promotion at the community level. She says the journey to institutionalize CHPs has been challenging, but the official recognition in the Kenyan law makes the hurdles worthwhile. But how are community health promoters identified and trained?
So we have a basic training package that has about 6 modules, just teaching them about how to get into a home, how to talk, so some basic communication skills, and also issues around water and sanitation, because those are critical issues.
She says the country will only achieve universal health coverage by having a robust primary health care that is driven by community health promoters.
We recognize that without communities, there's no health, because health does not begin in the hospital. It begins at home. The decisions that people make on what to eat in the morning, what you eat at, whatever meals you take, that's a health decision.
Currently, the country has a total of 108,000 CHPs working in the counties. Since healthcare is devolved, the national government only offers policy frameworks to guide CHPs' operations. The burden of non-communicable diseases has recently been on a steady rise. With the new prevention approach, these cases are expected to go down.
For us in community health, what we want is healthier communities. And we know that with healthier communities, we have both short and long-term benefits. For example, reduced in healthcare costs. Because if we identify our people early, or we identify patients early, then we can be able to plan for their care, and their care will not be very expensive.
So how will the government address issues of stockouts among the CHPs?
And the primary healthcare fund will be publicly financed through Exchequer to ensure that preventive and promotive services that take place at level 1, which is community, level 2, which is a dispensary, and level 3, which is health centers, are fully financed. Yeah, so that would include when the facility is ordering for their medicines. They also include the medicines for the communities.
Poor health-seeking behaviors among Kenyans is expected to be a thing of the past, as the government is banking on CHPs to facilitate referrals of patients needing medical attention from their homes. In return, this will ensure there is early detection of diseases and make treatment cost-effective. Belden Walieula, KTN News.
Time for another break. When we come back,